Welcome to Where Science Meets Self-Care with Ida Finelli. With over 30 years in beauty and wellness and a background in medical science, Ida blends clinical knowledge with holistic care. Each week, she and her guests share insights to help you achieve healthier skin, balanced energy, and empowered self-care. Now, here's your host, Ida Finelli.
Today, I'm excited to introduce Peggy Smith, the creator of The Holistic Nurse. Her show airs on Thursdays at 12 p.m. Peggy wears many hats. She's an independent nurse, animal rescuer, and skilled hypnotist practitioner, helping clients with everything from pain management to emotional wellness. She's joining us from Philadelphia. Let's dive into her inspiring work and unique healing approach. Thank you for joining me today. Can you tell us a bit about your personal and professional journey and what inspired you to become a holistic nurse?
Sure, I'm glad to be here. Thank you for having me. I'm a registered nurse in the United States, almost 45 years, and never realized until my mother passed away at like 95 how holistic she was. So I grew up with a lot of, things like she cleaned with vinegar. And when I was in high school, I wanted to color my hair. She didn't let me. She let me use lemon juice. And I thought, gosh, my mother's weird. Until when she passed away, I saw she had 10,000 little cue cards of different things, hacks for life. My nursing specialty has been hospice and oncology. I'm a cancer survivor myself since 2003. And I'm one of those people that cannot take medication. I have no tolerance for even a Tylenol, put me to sleep. And I wanted to be able to offer my patients alternative ways of managing pain and the side effects that come in the cancer journey. And then we had the opioid crisis and the difficulty of getting medication. So it really became a timely subject. Over the years, I started off with hypnosis for medical pain management. And I was a Reiki master at the time, also because of hospice. I've expanded to several other modalities of energy medicine. And I've expanded into patient advocacy because, at least in my country, it's a lot more challenging to access healthcare. And many people are left without insurance sometimes. They're left without access to nearby doctors. So this is not a replacement for medical services, but it's a way to enhance the care and teach you how to communicate with the doctors you do have.
And what kind of conversations or themes do you focus on in your show? And how has your show influenced you to practice and outreach?
It's actually helped me be more aware. Sometimes nursing is so chaotic and such a hustle bustle that we don't always stop to listen to the patients as well as we should. And certainly the nurses listen better than your doctors do. But it's actually opened my eyes to cues that I hear from patients about their experiences when they're in the hospital, things like that. I don't believe in practicing what I don't preach, but sometimes life gets in the way and you have all the good intentions and, you don't drink as much water as you should. You don't get the sleep, little things like that. I don't look at it as a negative. It just motivates me to make sure that whatever I'm offering to other people, it's something that I am very familiar with and a practice in my own life. And I know it works or can be helpful.
Have you had a standout moment or feedback from viewers that really touched you?
Gee, that's almost like a trick question. Let me think. I would say that I've learned a lot from my international guests. We've had a shaman from South Africa. We've had people in other countries. Other countries and cultures are more accepting, it seems, of alternative and complementary medicine. And I've learned also how to pick up cues on the people I'm interviewing, because as a medically licensed person, I have to make sure that I still protect my license first, both online activities and what I'm teaching people. There was one particular guest, I realized, oh my gosh, this is not the direction I wanted to go. And I had to really focus on my questions to get the results I wanted. And it's taught me a lot about myself and my own skills, unrelated to complementary medicine. I think it's made me a better traditional nurse in the process.
You integrate conventional nursing, hypnosis, and teach people about regenerative techniques. Can you walk us through how you blend those worlds in your work?
Well, for instance, I just recently left the home of somebody who had had bariatric surgery with some complications. And I learned, I guess, a few years back that many doctors, at least a few years ago, were not stressing the importance of taking the vitamin. And that's why they were having current, mistakes. And I've even had practitioners profess to be practicing a particular modality, say herbalistic medicine or whatever. And when I ask the question a nurse has to ask, you monitor lab work and things like that. I mean, even a functional medicine doctor does that. I've had the answer was online. Well, gee, they're just herbs. They're not really medicine. And so it made me acutely aware of how much education is necessary. And even if it's the most benign alternative method, there may also be somewhere that's going to have an adverse reaction, either due to interactions of what they already do, or other physiological factors going on in their body. Everything is not for everybody, and I really stress communicating with your medical provider. So that's probably a big influence.
I actually had hypnosis over 35 years ago for stress relief. It was a one-time session with calming music, an ionizer, and even a cassette tape to help me remember the experience. At the time, I wasn't sure how much it worked, but once I began energy healing in 1998, I really started believing in the power of the mind. So let's talk about hypnosis because it's widely misunderstood. What's the most common misconception you encounter about hypnosis?
I think the most common misconception is that people think that I'm going to control their mind. I'm going to make them cluck like a chicken or do something they just totally out of character for their personality. And even people that have maybe years ago used smoking to stop smoking or hypnosis to stop smoking and it was successful, they still almost feel like, well, gee, I stopped because they controlled my mind. And so that's really probably the biggest barrier I have. And the other is many people feel that they are just unhypnotizable. And I have found over the years that the people that think they're most unable to be hypnotized are actually the easiest. We all hypnotize ourselves, self-hypnosis every day. We're at a red light, your mind is wandering three other places other than the cars around you. The commercials, that's a form of self-hypnosis. And there's so many ways that we've been hypnotizing ourselves. Like maybe an athlete might say he's getting psyched for the game or whatever, but it's just different labels. It's the same process.
What exactly happens during a session, and what kind of mental state or depth does a person enter during hypnosis to allow it to work on a neurological or energetic level?
The process begins usually with a traditional assessment interview. Mine may be a little more deeper than a non-medical hypnotherapist because I'm also looking for body clues. If they tell me what medications they're on, then that tells me some of the problems that I'm dealing with, and they don't even realize how many clues are in that. And I start off explaining that I'm not actually doing anything to them, that what the journey we're going to go on is a joint journey of just very intense relaxation. And that when you're relaxed in a state of mind, your mind is more open to suggestions that maybe you try to push off. There's things we're always telling the should haves and shouldn't. We're always telling ourselves, gee, I really should be doing this, but gosh, I don't want to get off the couch. This is too comfortable. And I know the dog wants to walk or go for a walk, but I can just open my back door. The yard's fenced in. We talk to ourselves all the time. And so I have found that probably 90% of the time, whatever reason people are seeking hypnosis is not the real reason that they want it. Like in the course of conversation, I discovered that yes, smoking's a problem, but the real problem is I'm OCD, or I just can't sleep at night. I'm stressed out all the time. My job is terrible, and a lot of the psychology type should haves and shouldn'ts, and we judge ourselves, and we're really kind of cruel to ourselves, not intentionally. It's just human nature. So I try to keep everything positive. I'm not going to say, when you're smoking a cigarette, it's going to smell like dog doo-doo or anything else. I don't say anything aversive. I actually create a situation in their mind where they understand and they want to do what make the changes, and that has better results than if I'm trying to do it a negative way. Our kids negatively. If you don't do this, I'm going to break your arm. Well, the kid finally figured out he was a teenager. We're not really going to break their arm or leg. I try to keep everything very positive. And their body and the mind, I learned as I got introduced to more energy medicine, the mind wants to please. So if your body, even if what you're doing doesn't make any sense, it's not even maybe a traditional structured form of energy practice, it tells your mind that you're trying to reach a goal that's good for the body and it wants to help you. And that brings me a lot of success and also just a lot of good feelings that, I'm in the right track.
What is the difference between hypnosis and self-hypnosis?
Basically, hypnosis is something that I guide as a professional, but I teach them, and like you had I remember those cassette tapes. Still occasionally find one in an old drawer. I leave my clients with an MP3 that they can practice, because just like any new skill or habit, it improves with practice. I remember, years ago in Philadelphia, one of the summer holidays, maybe Independence Day, there was it's a big center city type festival they had with little booths and everything. My children were grade school and younger, preschool, and there was a psychic there. And I had so many preconceived notions about people reading my mind, controlling me. And while she's has the cards in front of me, I'm going, Mickey Mouse, Mickey Mouse, Mickey Mouse, just making sure my brain was empty. There was nothing she would ever know about me. I was there really to prove that she wasn't valid. A big gust of wind came and the cards blew on the ground. And I thought, oh, now let's see what happens. And I felt guilty that I didn't take advantage of her skill in the beginning of the interview. She had my 5-year-old pick up the cards and just drop them in any way they landed. And she continued her reading. And she knew, for instance, some very personal things about me. I've had several stillborns in my life, full-term pregnancies that weren't successful at the outcome, and other things going on. She knew my kids by name. It kind of blew my mind, but it made me really start reading about what is the mind and what is it capable of. And that's what I learned. I used to be anaphylactically allergic to shellfish. And there's a modality that I now practice, neuromodulation technique. It's called NMT. And I had a practitioner cure my allergy. And I mean, I still carry an EpiPen because I have a lot of allergies, I never know. But for that situation, I decided I would get trained as a practitioner so I could understand it. And I went to a seminar where there were doctors and chiropractors, other people. The founder of this technique was running the seminar. I had my medical history typed out and my EpiPen, and I went to one of the medical doctors and I said, listen, I'm going to volunteer to be a guinea pig. I'm anaphylactically allergic to shellfish. Let's see what he can do. And I can eat shellfish now. I don't have a great taste for it, but it used to be if I even smelled it, I couldn't breathe. I've had some really good mentors and teachers along the way who also practice the philosophy of I'm not sharing anything that I haven't tried myself. And it's been a blessing of an education for me that I never set out to achieve. I never set out to be a nurse either, actually. But the universe has its pattern. There's no coincidences, I think. There's a reason we do what we do, even if we don't know at the time.
Yeah. Are there people who aren't good candidates for hypnosis?
I would say that there are people who think they're not good candidates, and it's usually because of a variety of factors, including just so stressed out. And stress is the leading cause of so many psychological and medical issues. One of the big causes of cancer, blood pressure. So stress probably kills more people than any of those individual things: cancer, blood pressure, strokes. And like the functional medicine doctor doesn't just say, what are your symptoms? And here's some medicine to fix the symptoms. He goes to the root cause. And the people that haven't had the opportunity to discover that there are root causes, it's not just something they're born with and it's their genes, nothing they can do about it. Those people might not be good candidates. Somebody has a very serious organic mental health issue, one that's not just behavioral issues, but for genetics or whatever, that truly does need medication. Sometimes hypnosis can exacerbate some of the symptoms if the practitioner is not skilled in realizing what's happening. And if I have somebody with that kind of background, I usually refer them to a medical doctor that practices also, that can handle the other situations that can happen. I'm never going to be able to tell anybody to do something they wouldn't do in their natural state of mind. Hypnotherapists cannot say, go kill your mother, anything like that. It doesn't work that way. If you wouldn't do that in your normal state of mind, you're not going to do it because somebody told you to do it. I don't do anything that's against your basic personality characteristics, and I have no control over that. I mean, you come to me as you are, for symptom management or relief of different things, or to create new habits. And depending on how much baggage and layers is there, that kind of has an effect of the ability to reach the goal that they thought they came for. Many times just learning the stress management, which is a part of every session, I think cures a lot of the problems.
Are there any contraindications for hypnosis?
Basically, again, it goes back to the medical history, which I'm fortunate enough, being a medical practitioner, to understand how medical histories work and how to use that as a tool. If somebody wants to get over their fear of flying, but they have a pacemaker and defibrillator, and they've been told not a good idea. Well, maybe it's a valid reason. Your body's giving you this fear. You shouldn't be doing it. But I make sure in my initial assessment that I can judge whether or not a person is ready at this time. I'm not gonna. Somebody's in a very rocky marriage and they want me to give them a skill that helps them tell their spouse off or get the courage. We don't do it with hypnosis. We use other tools. So I've had a lot of people come to me saying, my doctor's saying this, this, and this. I don't believe him. I don't like it. I went to another doctor. He says the same thing. Can you teach me how to tell my doctor to go pound sand? Not so nice word. I kind of smile and I say, no, I'll never tell you that, but I can explain why he's telling you what he is telling you. And you guys, you can share your feelings. I can show you how to have a collaborative conversation and mutually. And I think you'll find the doctor who does respect your opinion, be able to reach a conclusion, whether it's find a different doctor, find something else, and that usually changes their attitude about the traditional providers.
You use hypnosis to support cancer patients with pain. How does that work in practice?
When you're in a very, very state of intense relaxation, and of course, pain, it's hard to get to that state. Typically, the medical provider gives you pain pills or other patches, whatever, but people don't use them until the pain is totally unbearable. It's already an 8 to a 10 level. If you know certain situations, or maybe you're going to go to physical therapy and that's going to create lots of pain, I recommend, and I teach my normal nursing patients, take the medicine ahead of the event, because then you're in a better physical shape to actually get the treatment you need. And you can enhance it by learning how to relax and knowing that you're in control. This pain is not going to just make you a total invalid. You can't do anything. And so that's the goal of every session, is just to really bolster someone's self-confidence and control in their own abilities. And I work with a lot of children because I was a pediatric nurse at one point. I always have the parents with them for the very young children. I let the teenagers decide if they want their parents there. But many times I have parents, wow, I feel so relaxed after this. I hope Johnny stops wetting the bed now, but it's okay. I'm relaxed. I won't flip out about it. Just controlling the stress is probably the real reason all of us do most of this. With the chaos in the medical fields and with business companies and insurance companies taking over medical care, telling the doctors what they can do and can't do. This is good for doctors too. It helps them relieve their stress. Unfortunately, a lot of them have decided they're leaving the field because they don't need the stress. But that's the key, I think, for a lot of what we do.
You also help with smoking cessation, weight loss, and emotional wellness. Which of these areas do you see the most transformation in?
I would say emotional wellness happens across the board, I think, with almost any reason people come to me, just because they've learned how to relax better, and that improves our emotional reactions to things. Smoking right now is a big issue, not just because of the cost. I know it's like, I think $10 or $12 a pack, I was told recently. I haven't actually bought one in years. So, and at one point when I was trying to encourage a young adult child to stop smoking, I actually purchased one of those vaping kits and a monthly prescription. And then I read the package, which explained to me how it works, the chemicals that hold that together. And so people really, faced with the possibility of maybe you're not going to have enough health insurance, they want to keep their bodies as healthy and clean as they can. And so they're motivated to be successful. You're at an age where you're a new grandmother and your kids are saying, I don't want my baby to smell you. That's a real big factor because a lot of people have financial issues and motivation to be healthier. The other thing, weight loss is still a challenge because it's so multifaceted, but people are beginning to understand all the complexities of medical issues that happen when you're even just a little bit overweight or don't exercise enough. And so it takes a little bit longer. Smoking can usually be done in one, at most 2 sessions. Weight loss takes a little bit, longer. It's a lot more to cover. It's hard to convince yourself that you're really going to lose the weight when you've been heavy all your life, for instance, and you have to counter those blocks.
How many sessions does it take for clients to see results?
That also would vary on their prior experiences to coming, their expectations. For the most part, smoking is at most maybe 2 sessions. Many therapists have like a package of 3 sessions to achieve the goal. And they use that across the board for different reasons, motivations for hypnosis. The first one is primarily that history getting one and getting them in the right mindset, and maybe just a real brief session to give them a feel of what it's like. The second one is like the real nitty gritty, we do it. And the third one is see, how do you feel and have we been successful? They're usually not all in the same week, usually a week or 2 weeks apart from each other, because changing habits takes 21 days, they say. I think that's pretty good, reliable barometer.
Has hypnosis been backed by scientific research? What does the data say?
Hypnosis has a lot of evidence-based research. Medical students now are getting what they call integrative medicine classes, which basically shows an understanding and a respect for our field too. And they know it's not their baseline education, but they understand that it can actually help get their job done. And I think it really does. The data absolutely is positive in our direction. There's even extra research to show if it wasn't successful, what other things were going on. I mean, obviously, it's hard to take something like that isolated and not look at all the other factors going into it. But basically, if you're able to train somebody, it's not what the bad event that causes your problems, it's how you react to that event. Life is full of negative events, from road rage and terrible diagnosis. We all live with life and birth and getting married and getting divorced. They're like the biggest life events to cause stress. Moving to a new house, even if it's not your dream home, it's a life stress causing event that can actually come with medical problems. The mind body connection is so intertwined. People with a lot of the GI upset, Crohn's disease, things that medical advice, evidence practice says what you eat is what you're going to produce. And I've gone to a Crohn's patient who's on all kinds of infusions and has all the anxiety of all the problems that are social problems he's encountered over their lifetime with this, decades of this problem. And I'll say, well, what kind of diet are you on? And he says, oh, my doctor said it doesn't matter what I eat. I'm just going to have this the rest of my life until it kills me. And I cringe when I hear that, especially if I'm not there as a hypnotist, I'm there as a nurse. But the good thing about nursing is that most nurses take a holistic view towards life. And, we see the things that doctors miss sometimes because the doctor's learning how to use a computer for the first time in his life sometimes. And if you go to a surgeon, he only knows to tell you what he can do for surgery. He's not going to be able to tell you other options that you have. And nursing, though, is taught to look at the whole person, and that's what I believe holistic is. So no matter where you come, Reiki, pain management, anything you come for, I'm usually picking up other problems or other challenges. I don't like to use the word problems. And people are amazed that, gosh, they never realized that that's what was causing this. There are some mild temporary side effects, if you want to. I don't want to use that word. Say a person has high blood pressure, is on a lot of meds and everything, takes his meds as you absolutely should. I'll never tell someone not to. I do tell people to record that when they take their medications like that, the time of day they're doing it and what the blood pressure is, and maybe check it again 2 hours after your medication to give that doctor that information. But because you learn how to relax, and if it's very, very successful, even on the first visit, it can be enough to make you dizzy. And just because for the first time in years, maybe your blood pressure has gone down to normal and your body doesn't know how to handle it. I let people know if I know a person has that kind of history. Anxiety and panic attacks have so many physiological symptoms that we're cautious about. Nobody's going to leave here in a state where they're not safe enough to drive their car home or anything like that. A session always wakes you. I don't like to use the wake up. They bring you back to the present moment and reminds you that you are in full control, and it's going to take practice to reinforce what your mind heard. And if you fall asleep during the session, people think, oh, I fell asleep, I wasted my money. It's okay. Your subconscious mind heard everything, and it will come back and remind you when you need to be reminded.
You have a video on your site labeled Hypnosis for Pain Management, Philadelphia, PA. Can you share what's covered in it?
I teach people the medical perspective. If you're on medication, taking more pills is not going to fix the pain. If you need to function, especially productively and safely, whether it's driving a car or going to work while you're in treatments or whatever, I teach mindfulness as part of pain management because it helps you be aware and listen to your body. I teach getting ahead of the bad pain. It's okay to take the medication, but you need to take it before it's really bad, because PT, you're going to just be wiped out totally when you get to that physical therapist, and you're not going to be able to get the full benefit of your therapy session if you're in intense pain. It's a major distraction to all aspects of your life, as most people in chronic pain know. And I let them know that part of their anxiety comes from not having access to the traditional modalities maybe that they've used for years, because the insurance companies just aren't doing it. The doctors aren't even allowed. Only the specialist pain management provides those medicines now. It's a complicated situation, but I encourage people to believe in themselves and empower them to do what you can. And if it's not enough, let your doctors know where you need to enhance what you're trying to do. So many doctors assume years ago, you went to pain management, usually if you were really addicted to the prescription drugs and things like that. The average person who maybe has a temporary situation but needs pain management, sometimes the doctors still, unfortunately, look like everybody's here just to get my script, and they don't see the whole person. And that's when the skills of learning how to talk and really express what's going on come in handy.
Breathing's a big part of getting into relaxation, and you have a technique called box breathing. Would you like to share it with us?
Sure, I'd be happy to. There's several quick. Box breathing is one of the shorter ones, and in seconds you can actually lower your blood pressure and get to a state of calmness. They do it while you're driving, of course, but if you're at a long red light, you're stuck at a train track and you're in a hurry, and that Amtrak train's got 100 cars and you lost track counting, I mean, they got more pissed off. Box breathing is very simple. You just inhale slowly through your nose for the count of 4. So you go take a deep breath. 1, 2, 3, 4, and then you exhale for a count of 8. And then you repeat that cycle several times, as long as you can do it safely, as long as and you usually find 2 or 3 times in the cycle, you've slowed your heart rate down just by controlling your breathing. I practice as an infusion nurse, and I learned over the years, for some reason, I was never one of those patients, but when I'm going to stick somebody with a needle, they hold their breath for some reason, and the blood doesn't flow when you're not breathing.
Oh, dear.
So I guess, as a laboratory technician, you might realize that too. But one man, I'd never met him before, and I knew I was in the vein. The blood wasn't there. He didn't have many vein choices to go to if I had to re-stick him. And I said to his wife, does your husband have anxiety issues? He said, oh, he does. Does that affect anything? Honey, didn't you take your pills? And, but once I explained the blood will flow if you just take some deep breaths. And sometimes I don't even say that to them. They just pick up on my breathing and the calmness. And when I see that they're breathing like I am, all of a sudden the blood flows. Teach nurses fusion techniques. You're usually in the vein 90% or more of the time. You just relax, because a new nurse especially will panic. Oh my God, I got to stick him again. He's going to be mad. And, and then they get anxious, and everybody's anxious, and nothing happens. So there's been times I've kept that IV catheter in for an extra minute or two, and just, okay, let's just take some deep breaths, and there's my blood. It relieves my anxiety, and it helps them. And we don't realize how important breathing is.
Yeah,
I used it in childbirth.
Really crucial.
There are actually hypnotherapists that specialize in hypnobirth, doing hypnosis for childbirth. I didn't have that experience with my multiple pregnancies, but I did take the Lamaze classes, which basically teaches breathing techniques. And you realize that you might learn something somewhere in your life for a particular vision purpose, but if you think about what you're actually doing and not robotically repeating it, you realize it's something that you can use in all kinds of situations in life.
Right. Do you do hypnosis on yourself?
Not as often as I should. Nurses are good people for do as I say, not as I do. And
I
that's
hear
why
you.
even in holistic healthcare, a lot of times if I'm hypnotized, doing a session on a problem, a situation that applies in my life, I've actually caught myself thinking as we're doing the session, okay, brain, this is for her. Don't pay attention. You don't want to hear that you're not doing it. And I laugh. I think having a sense of humor is important, if not the most important, along learning how to breathe and just relax better in stress management. And it is difficult. You used to see, you don't see it as much anymore, thank God. But right outside the hospital doors would be nurses and doctors having a cigarette. I don't see that as much. I had an experience with a nurse that I was supervising, a home care nurse, and her patient complained she smells terrible when she gets here. So I had to talk to her. And she said, well, that's not possible. Before I get out of the car, I spray myself with Febreze. Well, if you know you got to spray yourself with an air freshener, then probably has a valid complaint. The kids are aware, even if they don't say, and now they hear it on the commercials, and they feel bad if you're a child of a parent who's still smoking. Because they're also hearing in the commercials the side effects. Mommy, don't you love me? Why do you want to die? Commercial says that the lady didn't know her mother. Her mother died when she was 16, couldn't see her graduate. And the younger kids are picking up on that too. And they don't want to be left without a parent, if it's not at all available. In hospice, you have to face certain realities. But if you can go there without thinking about the bucket list you never filled, I try to encourage people to just learn to love ourselves. When you do that, I think more motivated to really be good to yourself, and you learn to set boundaries better. That is all part of what we do.
In addition to your work with people, you also rescue animals, particularly dogs. I have to ask, can you do hypnosis on a dog?
I can do Reiki on the dogs, and I can use breathing techniques next to my dog, and he's really, really anxious. And I have a couple that are on Prozac. So yes, they're working on that. We practice a lot. Just by me cuddling them and me watching my breathing, and while I'm holding them or stroking them, it encourages them to really work, and they calm down. And Reiki is another energetic medicine form that I practice. Reiki is just the quantum physics principles and everything. It works with animals, it works with plants, it works with so many things, and it's basically free once you learn the skills. It's something that it's a toolbox, it's a first aid kit in your pocket all the time.
Yeah, I know I do energy work, and I know it's helped me a lot.
Tapping is another thing.
Yeah.
And some of the tapping techniques, we also encourage learning to love yourself and accept yourself. And
do you do tapping as well?
I do tapping. I struggle with it sometimes because I have issues that it has really helped or could help even more. And it's like I feel guilty if I'm doing it for other people and not doing it for myself. There's a form called TAPIS for migraine headaches, where basically it's like using the acupressure points, and you put your fingers right, and the headache goes away with no medication. And whether it's a stress or even if it's a physiological headache, it still decreases the pressure of it enough that you can deal with what you need to do medically. So there's just so many techniques that the NMT that cured my shellfish allergy, that's quantum physics based. And you talk to the autonomic nervous system, and you can For pain management with NMT, you're actually telling your autonomic nervous system, the practitioner is, to raise your pain threshold so that a number 6 pain really feels like a 2. Do that, and the pain is still the same, but the way you're perceiving it is different. So you get the same result.
For those of you that don't know what we're talking about, we were talking about emotional freedom techniques, which involves tapping on meridian line points on the face, neck, and underarms. And it's like a neuro-linguistic programming. You're talking at the same time as working on the meridian lines to help different issues, because every meridian line not only represents an emotion, it also represents physical pain, so you can use it for both things.
And the same way, Reiki and other techniques go along the chakras, and each chakra, the 7 chakras, represents a different part of your body. I had a good teacher and mentor over the years who, if she even sees me I also was her dog sitter, so I'd see her frequently, officially, working together, and sees me even react to something that I don't have to be reacting to. She might just casually say a cue word that she uses in her practice, and it makes me laugh because I wasn't aware of it. Sometimes mindfulness is not perfect, no matter how much you practice.
Yeah.
Sometimes people need their illness or their problems, and if there's enough of that forces in their body, until they're able to really be ready to accept that they don't need those problems, they can substitute those issues that trigger those problems with a different attitude, and that's when you have the most success, I think. But not everybody's ready. Like, you can lead a horse to water, but you can't make him drink. It's okay if somebody comes for a problem holistically and they're not ready. If you have a serious medical problem that needs attention and you're not ready, that's a different story. Then you really want to consider alternative help, maybe, to get your mindset ready to deal with what you need to deal with, and because their time is of the essence.
We're getting near the end of the show now. So where can people find out more about your services, your show, or connect with you directly?
Well, I am weekly, Thursdays, 12 noon to 1 p.m., where we interview a variety of international practitioners around the world and talk about the cultural differences and things. I also will touch on topics that seem timely as far as patient advocacy, if you're having problems in traditional healthcare, how you can deal with those problems. And I'm also, my email is not just hypnosis, which is the 3 words run together, NOTJUSTHYPNOSIS@gmail.com. And I practice both remotely and in person. There is benefits to both type, but during COVID, it became a necessity. A lot of us learned to be good at the virtual, and it is just as effective, but some people prefer the in-person. Reiki does distance and it works, but some people need, cancer patients, but they like to know you're right there with them and sharing the journey with them. And my phone number, I can be reached. It's 1-267-593-5557. If people have issues and you're in whatever part of the country and now world, I have a very good resource list that I can direct you to supporting organizations and places where you can get the Unite for Her is a worldwide organization now that supports patients with breast cancer, which is male and female, and women, typically women cancers. And there's a lot of support organizations for any of those major health problems. And I have resource lists. So I'm happy to share that with anybody. Just send me an email and be glad to share what you need.
Thank you, Peggy. I've had so much.
Thank you for having me. It's always a pleasure. And I've had a chance in the last couple of weeks to really look at your archives and stuff. And you help a lot of people too. We're out there to help, and we're not as costly as your insurance. But a lot of times, a lot of medical things cost more than they should. There's some things though that you cannot go without. We can help you get through the journey in what we do.
Yeah, that's true. Information is power.
Information is definitely power. Yes, you said it well. Thank you. Thanks for having me.
Okay, so I'll just remind everybody, she's on the Holistic Nurse every Thursday at 12 p.m. And all this information will be in the description section. Thank you so much.
Thank you for tuning in to Where Science Meets Self-Care with Ida Finelli. Ida bridges clinical science with holistic wisdom, guiding you toward radiant skin, balanced energy, and lasting well-being. Don't forget to subscribe, share the show, and join us next time for more inspiration and practical tools to help you live beautifully inside and out. To connect with Ida, visit linktree/Ida Finelli. Until then, take good care of yourself. And remember, self-care is where science and soul meet.